exercise prescription, right? Otherwise known as like physical therapy, right? Or therapeutic exercise. Look, there's a lot of overlap, and people don't realize this most of the time, between physical therapists and chiropractors. In a lot of instances, you can't tell the difference between either one. A lot of these in Colorado, PTs are actually doing adjustments. They call them manipulations. And most chiropractors out there these days are doing a lot of physical therapy exercises, right? And here's the reason why. Spinal stability and distal joint mobility, that's what keeps us healthy and moving and out of pain. And so when somebody says, yeah, I got low back pain or I got neck pain or whatever it is, and we come in and we get them adjusted, we get those joints moving again, right? If that pain has been there for any amount of time, the muscles that work on that joint, right, have become inhibited. There's fancy words for it, autogenic inhibition or reflexive inhibition. But those muscles then, if it's a long enough period of time, they've forgotten how to work. And so what we do is we facilitate the joints moving. Those joints, the ligaments in those joints, actually tell these muscles what to do, how to support the spine. And so when the joints aren't moving, those muscles don't get the right direction. We get the joints moving properly, right, through proper chiropractic adjustment. Now there's information going to the muscles, but they've been asleep for a minute, so they're not contracting with the right force at the right time. So you got to retrain them. This is why we do, functional movement, physical therapy type exercises, exercise prescription, whatever you want to call it. Once you get mobility with the joints, you've got to get some stability in the spine. So I sound like a physical therapist when I'm talking right now, but it's just the truth, right? A lot of times we'll send people home with, TheraBands. If they've got mobility balls at home, we'll train them on that here and then they go do it at the house. Mostly it's just body weight, but it's addressing the areas that have become weak or dormant because of typically spinal dysfunction. Sometimes it's just straight deconditioning, just people are not moving their bodies, they're just not doing it. So they don't really get better as well or as fast in most cases unless we prescribe some exercises for them to do at home. And typically after about 2 weeks, the results are dramatic and it doesn't take a lot. So that's what it is. We always combine therapeutic exercise with these adjustments.